Hey everyone, welcome back to Alpha Nutrition. Today, we're going to talk about the key differences between AIDS and HIV. First things first, it's important to understand that HIV, human immunodeficiency virus, and AIDS, acquired immunodeficiency syndrome, is not the same thing. HIV is a virus that attacks the immune system, while AIDS is a condition that can develop when HIV is left untreated. HIV is transmitted through certain bodily fluids, such as blood, semen, vaginal fluids, and breast milk. It can be spread through sexual contact, sharing needles or syringes, or from mother to child during pregnancy, childbirth, or breastfeeding. It's important to note that HIV cannot be transmitted through casual contacts, like shaking hands or sharing food. When a person contacts HIV, the virus attacks and weakens their immune system by destroying certain cells called CD4 cells, also known as T cells. As the virus progresses, the immune system becomes increasingly compromised, making the person more vulnerable to infections and illnesses. On the other hand, AIDS is a condition that can develop when HIV is left untreated or not properly managed with medication. AIDS is characterized by a severely compromised immune system, making the person susceptible to various infections and illnesses. The term AIDS is used to describe the most advanced stage of HIV infection. In general, a person is considered to have AIDS when their CD4 count drops below 200 cells per cubic millimeter or they develop an AIDS-defining condition, such as pneumonia, Kaposi sarcoma, or cytomegalovirus. It's important to understand that HIV can be managed with antiretroviral therapy, ART, which involves taking a combination of medications to suppress the virus and prevent its progression. When HIV is properly managed with ART, a person's CD4 count can improve, and their immune system can become stronger, reducing the risk of developing AIDS. Antiretroviral therapy, ART, is a combination of drugs that target different stages of the HIV life cycle, slowing the replication of the virus and reducing the amount of virus in the blood. ART can reduce the risk of transmission to others when taken as prescribed. To sum it up, HIV and AIDS are related but not the same thing. HIV attacks the immune system, while AIDS can be developed when HIV is left untreated. AIDS is not a virus, but a condition that results from the damage that HIV does to the immune system. When a person with HIV has a CD4 count of fewer than 200 cells per cubic millimeter of blood, then he or she develops an AIDS-defining illness. AIDS-defining illnesses are a group of serious infections and cancers that are more likely to occur when the immune system is severely compromised. Currently, there is no cure for HIV or AIDS, but there are treatment options available to manage the symptoms and extend life expectancy. As mentioned, the primary treatment for HIV is antiretroviral therapy, ART, which involves taking a combination of medications to reduce the amount of virus in the body and boost the immune system. For people who have led to AIDS, treatment focuses on managing the opportunistic infections that arise due to the weakened immune system. This may involve taking medications to prevent or treat infections, as well as managing the symptoms of those infections. This includes using protection during sexual activity, getting tested for HIV regularly, and avoiding the use of intravenous drugs. In addition, it is also important to note that HIV and AIDS disproportionately affect certain populations, including men who have sex with men, people who inject drugs, and people of color. It is important to get tested for HIV if you are sexually active or have shared needles or other injection equipment. However, it's important to note that HIV-positive individuals are at a higher risk for certain health conditions, such as cardiovascular disease and some types of cancer. HIV and AIDS are not death sentences. With proper medical care, people living with HIV and AIDS can lead healthy, productive lives. Early diagnosis and treatment of HIV can improve health outcomes and reduce the risk of transmission to others. On top of that, understanding the key differences between HIV and AIDS is an important step in this process. The treatment of HIV and AIDS requires ongoing medical care and monitoring. People with HIV and AIDS should work closely with their healthcare providers to develop a treatment plan that meets their individual needs. Addressing these disparities and increasing access to testing and treatment for marginalized communities is crucial in the fight against HIV and AIDS. There is ongoing research into new treatments and potential cures for HIV and AIDS. Researchers are exploring new antiretroviral drugs, vaccines, and gene therapies that could lead to a cure for these diseases. In line with medical treatment, people with HIV and AIDS can benefit from support from family, friends, and support groups. The emotional and psychological impact of living with these diseases can be significant, and it is important for people to have a strong support system in place. In fact, the best way to prevent both HIV and AIDS is through education and practicing safe behaviors. Note that HIV and AIDS are serious diseases that affect millions of people worldwide. While there is no cure for either disease, effective treatments are available that can help people live long, healthy lives. It is important for people to be aware of the key differences between HIV and AIDS, and to seek medical care and support if they have been diagnosed with either condition. The ongoing research is bringing us closer to a potential cure for these diseases, but in the meantime, medical treatment and support are critical to managing these conditions. Thank you for watching, and be sure to stay informed and educated about HIV and AIDS. If you have any questions or concerns, don't hesitate to speak with a healthcare professional.